Hello everyone, I'm Salva Lesci and I'm the Chief Scientist and Strategy Officer at Beyond Celiac. Today I would like to take a few minutes of your time to introduce myself and share with you some thoughts around what I'm sure it's in everyone's mind, the COVID-19 pandemic. Beyond Celiac, our organization since the very beginning, in fact since before this was identified as a pandemic, has acted in support of the Celiac disease patient community and their family, with a particular focus on three priorities. Do our best to keep you healthy, informed, and engaged. So let me share with you a few thoughts about each of these priorities, starting with staying healthy. When I talk about being healthy, I refer to the overall well-being, physical health, mental health combined. There is no question that this is a very challenging situation, and I would just say in a way unprecedented. We are dealing with an invisible threat, one that becomes visible actually only when you get sick. We are dealing with something that we don't know too much about it, so kind of scary for most. So we feel like very often we are in the dark, and that of course generates a tremendous amount of uncertainty, anxiety, and of course that goes on top of some of the panic that is being generated. And I think if you ask me, the panic is the worst thing that can happen in situation like this, although it's of course hard to keep rational thoughts and thinking in general straight in situation like this. Having said that, there are a few things that perhaps we tend to almost isolate from our thinking that provide a little bit of a better outlook, especially if we compare how we may be dealing with a situation like this now as opposed to even 20, 30 years ago. Thinking particularly at the science and technology tool that we have at our disposal. I can't think of any larger or smaller biopharmaceutical company, diagnostic company, research organization, including government research, that is not allocating substantial resources either to improve or accelerate the diagnosis of the disease or the development of a treatment of the disease. And there has been progress being made. Just a few days ago, we heard that the FDA approved a diagnostic test which allows to get a readout of the diagnosis much faster than before. Still, we can do better, and I know there are efforts to develop even faster diagnostic tool, and maybe they can be more scalable and also affordable, so that we can deal with one of the challenges that we are facing, which is how we really try to identify those that have the virus and perhaps are asymptomatic and may spread it to others without knowing. But there has been progress also on the therapeutic side. You must have heard that there are drugs that have been used for other medical conditions, like to treat malaria or to treat some bacterial infection or even the flu, like the country registering or the country Japan and others that are currently being tested in clinical trials to make sure that to see actually if they are first of all safe but also effective perhaps in at least counteracting the COVID-19 infection to some extent. And some of the preliminary result seems promising, but of course we need to make sure that these data are confirmed. And then of course there are a series of new treatment that kind of affect the immune system, like monoclonal antibodies, or also purified plasma derived product. These are products that are kind of derived from plasma of sick patient being purified and used almost as a weapon against people that just get the disease. Again, product purified from plasma of patients that are healed. As well, of course, vaccine. This will take a little bit longer to have them. So there are a lot of efforts in place. And let me tell you, as somebody that has worked in the biopharmaceutical sector and looking at the amount of resources being put and the collaboration between all the players, including regulators, the FDA, I remain optimistic that within a few months we may have some therapeutic options. I think this leads me to going back to the issue of staying healthy and how to keep healthy. Again, I mentioned before, when I talk about health, I like to refer more like well-being, physical, mental health. One of the challenge that we are facing right now is that we tend to be in a situation where it becomes a little bit challenging to stay healthy. We are stuck home, we have a lot of time, and on one end, sometimes our health choices in terms of eating may be not as good. Sometimes just because we may not find the food that we want. I know this has been a challenge, particularly for patients with celiac disease. But this is a time where it becomes even more important for you in particular keep a healthy, not just a strictly gluten-free diet, but also a healthy diet. That's important because having a healthy diet is one of the way to keep your immune system healthy. And another way to keep your immune system healthy is by exercising regularly. And again, even this has been a challenge. Our fitness clubs are closed. That has been a challenge for myself as well. And not everyone has a gym at home or likes or is used to exercise at home. So at the same time, this is there are so many apps that you have on your phone and other things that you can do to exercise. So no excuses is very important. And then, of course, the issue of mental health. No question that the current situation has raised level of anxiety among the general population. But that may be particularly true also among patients with celiac disease. We know that there is increasing evidence that in addition to the gastrointestinal symptom, there are a series of symptoms not related to gastrointestinal manifestation, and particularly what I call psychoneurological symptoms. And anxiety seems more prevalent. Again, this data needs to be confirmed. There is more research needed. But observations show that particularly in the younger population with celiac disease, there is a higher level of anxiety. So in a situation like this, it becomes even more of a priority, important for patients with celiac to find way to manage their anxiety through, practicing meditation, for example. I know it's harder, but perhaps being kind of forced confined in your house, you become more incentivized to find ways to meditate, practicing yoga, and other activity that can help kind of lowering your anxiety level, like down and controlling and focusing really on what you can control. I would just say a good way is also to not just practicing social distancing, but sometimes practicing social media distancing. Particularly, we are constantly bombarded by news. It's good sometimes to just take a pause and disconnect and find time to do a little bit of self-focusing. I was reading actually a great quote, I don't remember where, but it's something I want to share. You say, if you can go outside, try to go inside. I mean, I think it really illustrates something you can do at this moment. I also want to make another reflection. I mean, we got a lot of concern about patient with celiac disease perhaps being more risk because of their immune condition, autoimmunity, a lot of confusion between autoimmunity, immune depression, two very different things. Again, I'm not gonna go into that. Has been addressed by my colleagues in another videos. Also, we have very detailed Q&A. But one reflection I was making is that in a way, patients with celiac disease are under a constant threat. And that threat is not COVID-19, it is gluten contamination. And I would think that by the nature of the disease, the patients, the people with celiac disease, I like the word people better than patient, really, have almost a natural tendency to be extra careful in a number of choices that they make, of course, food choices. So I would ask you to apply the same mindset that you do in being careful with your food choices to prevent the threat of being gluten to the choices that you make right now that can help you preventing being infected with all the things that we're hearing and we know from watching your health for the appropriate length of time and the appropriate in a careful way, to practicing social distancing, avoiding crowded space. Again, I don't need to repeat this. So I'd like to think and almost distill the thought in you that you as a celiac disease patient are naturally more resilient and can apply that same kind of mindset that is part of your daily life to the current situation, which would make you would reduce your risk of being exposed to the virus, getting infected in the disease. The important point that comes with that is also the following. Think about it, that hopefully you will not, none of us will get infected, definitely not sick, particularly in a severe way. But if they happen, what you want to do is to happen as far as away as possible, so that by the time, if and hopefully will not happen, there are at least some therapeutic options available. So switching gear a little bit, I talk about keeping healthy for us as helping you doing it as a priority. Second one is keeping you informed. We have spent, with my team, the science team, we spent quite a bit of time going out and just focusing on filtering information and try to share with you in a way that is both simple, comprehensive, and accurate, and perhaps as important, and as we mentioned on our website, evidence-based. We are really looking for evidence-based information. One of the strengths I think we have now, and is helping you in a way coping with this situation, is that the flow of information is amazing. We can get really information by the hour. Unfortunately, in most cases, this information, again, as I mentioned, help create anxiety and so on, but we can constantly follow the new development. However, the quality of the information is not consistent, and this happens all the time. So it becomes very important to make sure that you're able to distinguish what is called fake news, or maybe unintended bad news or partially good news from real news. Again, we are doing our best to be careful in this space, but we see this as a dialogue. So we may miss some bad news or fake news or so on, or even some good news. So, you are very active, and as I'm learning, a very educated patient population, people population, please feel free to always reach out to us if there are things particular that you find controversial or unclear. We really want to make sure that you have the most updated information, but also the most accurate at any time. And we are trying again on a daily basis to provide information in various formats through all the different channels that we have. This also leads me to the last point I wanted to make today and prior, which is stay engaged. I mentioned before, it's obvious to all, part of the challenge that we are facing now, we feel a little bit limited in our freedom, right? We can congregate as much as we want with our friends physically, but that doesn't mean we can continue to engage with each other. And in fact, again, the beauty of technology allows us to do things like what I'm doing, still stay here in front of my phone and very soon having my message shared with the entire community. So in the face of the challenge that we are living together, I see this as a great opportunity. Certainly I see this as a great opportunity for our organization to not just stay connected with you, but almost to kind of build that what I call a digital community. And hopefully this actually is something that we can continue to keep and expand beyond this crisis as a way of really work together towards our common goal, which is ultimately to find a cure, accelerate finding a cure for celiac disease. Let's not forget that. Certainly we don't forget that at all, even in challenging time like this. We continue to pursue that as our primary goal. Where I'm going with this is that in addition to sharing information that becomes available by third-party others, we think it's very important at this time to collect information, to have that interaction with you that would allow us to get a better understanding of what you are going through. And again, I'm not talking just about information that we may want to collect if you get sick, hopefully not, but of course it would be important for us to figure it out as appropriate, whatever you can share, but also how you feel right now. Again, I was talking about anxiety. Is your anxiety level going up? How you are coping with that? Or even simply how this pandemic is changing the way you eat. Is it harder to find gluten-free food? Has been so much harder? Has been harder for you with the closure of the restaurant? Or maybe it doesn't matter because you were not going to restaurant in the first place. Things like this that may look not a big deal, I think can help us a lot understanding more the disease and helping with the research that we constantly are conducting. So I would hope that many of you here are familiar with the tool that we have. It's called Go Beyond Celiac. Again, gobeyondceliac.org. This is a database, a registry, repository, whatever you call it. It's like a digital tool accessible both through our website, but also through mobile phone. We have app for both Android and iPhone, Apple, and it's a tool that allows really to interact, collect information, but also allow you to constantly provide updates on different parameters related to your disease at a various level, and I think it's the best contribution that you can do, particularly during this time where I'm sure a number of you are bored in front of their computer, and there are probably as many emails and video games or movies, Netflix, that you can watch. But it would be a great service that you do to yourself, to the disease, and to ourselves as we help you. If you could even just take a look at the registry and if you like what you see, like contribute to it. Register. We already had a few thousand actually of people with celiac disease that have registered, and some of which actually have also follow up on with some of the surveys that we have. And as a matter of fact, very soon we have planned to deploy at least one survey, maybe more than one, that is tailored to the current situation. Again, to just have a better understanding of the interplay between COVID-19 pandemic, infection, disease, and celiac. And hopefully this data can help us not just understanding the current situation, but overall the challenge of the disease. So hopefully I didn't bother you with kind of these thoughts, but rather I provided something that can help you as you cope with like us with this new situation. And I would hope to also be more present with you through other videos in the near future, maybe some on specific topics. Again, if there is something in particular you would like for me to speak, feel free to make suggestion. Again, one last reflection I want to do. I think I like to, again, keep an optimistic view of the situation. I'm an optimist by nature. And also as a physician scientist, I have to be optimistic about the fact that we're not going to be put down by a virus. Otherwise, I wouldn't choose to do this profession. And eventually we're going to win and prevail. But also, I'm a strong believer in learning. And there is a great learning that I've seen here that, again, at Beyond Celiac, as an organization, we want to borrow. And is that when a situation becomes an emergency, you see pretty much everyone mobilizing resources around it to try to find a solution. I like to think that once this threat is past, we may think about celiac the same way. Celiac may not look like a threat to most people. I'm sure it is to you, each one of you. And we should kind of approach with the same momentum, with the same intensity, with the same deployment of resources as we are approaching the current threat. Now, this is a little bit of aspirational, but personally, I can give you my commitment that as we continue to partner with various organizations and together we pass through these dark days, I will do my best to make sure that the same sense of urgency that we are facing in addressing the current challenge, at least to some extent, is applied to finding a cure for celiac disease. Thank you for listening to me, and I look forward to speak with you again virtually and meeting with you again virtually in the near future.